Today's episode of Vital Voices is brought to you by Oak Tree Medical Center and Wellspring Lifestyle Group.
Are you enjoying Vital Voices? Do you find our conversations educational, engaging, and inspiring? Then like, subscribe, and tap that notification bell to keep updated on new episodes and more.
Vital Voices.
Welcome to Vital Voices, the podcast where we amplify the stories, insights, and expertise of the people shaping the future of our communities, our conversations, and our country. I'm your host, Alexis Burrows. Thank you for joining us each week on Vital Voices for the nation's most vital conversations, where insight meets impact. Today's episode is one that touches every industry and every worker. We're diving into occupational lung disease, what it is, who's most at risk, how to spot the warning signs early, and what can be done to prevent it. So whether you work in construction, agriculture, manufacturing, or healthcare, this is a conversation that could protect your health or even save your life. Joining us is someone uniquely positioned to help us understand the full picture, from early symptoms in primary care settings to life-threatening complications in the ICU. Dr. Patton Adderley, MBBS, Diplomat ABIM, is an internist and Pulmonary and Critical Care Medicine Fellow at the University of Maryland Medical Center. He graduated from the University of the West Indies Medical School and completed his internal medicine residency at the University of Miami JFK Medical Center, where he also served an additional year as academic chief medical resident. He is currently pursuing fellowship training in Baltimore with clinical interest in advanced bronchoscopy and oncopulmonary medicine. Dr. Adderley, welcome to Vital Voices.
Thanks so much for having me.
All right, so, this is a very interesting conversation. Paige and I were kind of, we plot out the podcast. We try to plot it out a few weeks, months in advance. And I remember us sitting down probably about maybe 2 months ago now and saying, it'd be interesting to get Patton on the show because obviously, you guys go way back into your UE days. And we were kind of going back and forth, like, what would be an interesting topic to tackle for someone who's in this space? And she was like, well, you think about people who end up in these lung disease situations where it might be caused by their work environment. So, we did a little bit of research, she and I, and obviously we kind of pitched the topic to you, and here we are. So I'm very interested in kind of going through this conversation with you and helping people to understand what might play influence in things like their lung health when it comes to your work environment. So we're happy to have you on the show to walk us through that. So, give us a definition. Like, what is occupational lung disease, and why is it a growing concern in the medical field?
Yes, absolutely. So occupational lung disease is kind of like a big umbrella term. It actually refers to a group of respiratory conditions that can either be caused by or can lead to an exacerbation of a lung condition. And the thing that's usually caused by is an inhaled harmful substance. And this harmful substance just happened to occur in the workplace. So inhale a harmful substance in the workplace. The main group of substances we talk about are either inorganic dusts, so silica, asbestos, coal. I mean, behemoths don't mind coal, but that's a part of that big group. Organic dusts, so you think about airborne pollutants, right? Usually some form of plant or animal or bacterial biologic matter. So people in the agricultural industry, waste management, they get exposed to those. Toxic fumes or gases, so chlorine, people who clean pools, heavy solvents or like ammonia for people who are in housekeeping, and even cigarette smoke is a part of that. So your casino workers, bartenders. And we can't also forget infections. And I think COVID-19, the pandemic basically brought that into the forefront. So our healthcare workers, that is another type of occupational lung disease. And these types of harmful substances can then lead to the manifestation of disease. So we talk about something called the pneumoconioses, and that was that group of inorganic dust, so silica, asbestos leading to silicosis and asbestosis. Occupational related asthma is probably the most common work-related lung disease that we kind of think of. You can develop COPD, which is a chronic, obstructive, kind of destructive lung disease that results in irreversible airway obstruction. There's a condition known as hypersensitivity pneumonitis, And that was from those organic compounds I talked about. So your agricultural workers are at risk for that. The lung infections, like I said. And probably the most feared is occupational lung-related cancers. So secondhand cigarette smoke, we know, definitely is harmful to the lungs and can lead to cancer as well. And some of those inorganic dusts are well known to cause lung cancer too. So definitely very big, broad swath of diseases. And it's very important in the medical field for a few reasons. One, they go underdiagnosed because the symptoms that you will get into a little later that patients usually present with are very nonspecific. And, sadly, a lot of healthcare providers just don't really screen for occupational hazards or may not take a detailed occupational history, because if you present to your doctor with a cough and shortness of breath, I mean, common things being common, we're going to, discuss respiratory symptoms, make sure it's not cardiac involvement. But no one really takes the time to kind of deep dive into an occupational history. And then it's a pretty large burden on the healthcare system. Back in 2019, there was a statistic through the American Journal of Respiratory and Critical Care Medicine that basically stated that workplace exposures estimated to contribute to more than 10% of all lung diseases. And of that 10%, asthma, COPD, pulmonary fibrosis, and lung cancer made up a pretty significant fraction of that burden. So it definitely is a burden globally. It definitely can be prevented. You're going to work and you're getting exposed and you're ending up with a lung disease. So these are conditions that are preventable. So super important for healthcare providers to understand occupational lung diseases and to do our job with surveillance and ending exposure to prevent disease progression and increasing morbidity, mortality.
Yeah, I imagine, because I think when we were talking about it, and perhaps like people who work in nail salons might fall in that category as well, because that's something that's very high scent, chemical. And then also if you work in a building that has like mold and things like that. I mean, I know we've heard as someone growing up, I guess in the era that we grew up in, you would always hear the lawyer commercials, if you or someone has been exposed to asbestos and things like that. So it's something that I think we've heard of, but haven't necessarily given a lot of thought to, especially as a layman, like, what are some things that I might be exposed to that, might put me at risk or something like this. So given all of these things and all of the potential risks that you've indicated in terms of the types of occupations that people may be in, what exactly happens in the lungs when someone is exposed to these sorts of hazardous materials over time?
Yeah, so when someone gets exposed to these materials, a variety of things can happen. I mean, it's a lot of nitty-gritty science, but just in the broad way of thinking of it, you inhale something that's hazardous, it leads to inflammation in your lungs. And that inflammation, if that is allowed to continue, meaning that you've had either repetitive or prolonged exposure, it can then lead to airway remodeling, where the actual structure and anatomy of your lungs change. And then progressive lung injury and fibrosis, where the actual function of getting the oxygen from your lung to your bloodstream or removing the carbon dioxide from your blood to go back into the lungs and you can breathe it out, that function is just severely hampered, and that can lead to progressive respiratory failure, which can add to significant morbidity and death long term. So, if you want to break it down into the different types of irritants and what all they do, just kind of briefly, respiratory irritants, so like we talk about those toxic gases, fluorine gas, ammonia, they do the cytotoxic injury. So if you could only imagine something really toxic directly affecting the cells, causing something called oxidative stress, leading to that inflammation and remodeling and everything I just spoke about. Then you have those inhaled particles, so like that inorganic matter, right? The asbestos, the silica, the coal dust, they actually deposit in your airways, in the very small airways. And again, that triggers inflammation. They form these little kind of bodies known as granulomas. That's kind of your body's way of trying to wall off that irritant. And that in itself triggers inflammation and everything that I just spoke about. So pulmonary fibrosis, reduced lung function. Another thing that these particulates can do is increase the way your lungs respond to irritants. So we call it airway hyperresponsiveness, and that's all a part of that inflammatory cascade. So you may start to wheeze and have asthma-like symptoms, right? Shortness of breath, coughing. And so that's another type of pathophys that kind of fits into this whole cascade. And then lastly, when you think about those organic dusts, like the animal proteins, etc., that can cause something called a hypersensitivity pneumonitis. That's pretty important. It's basically a type of interstitial lung disease that has a very particular appearance on imaging. And it can lead to, like I said, the pulmonary fibrosis and whatnot. But it's important because the exposure, once it's stopped, you kind of have a dramatic resolution with your hypersensitivity pneumonitis if stopped in time. So again, very important to recognize these things and try to limit exposure. But just in summary, chronic exposure leading to airway remodeling, lung remodeling, fibrosis, and impaired respiratory function.
Yeah, you mentioned getting away from it, right? Like once you're kind of removed from the environment, which begs the question, how does exposure in the environment affect people differently, like depending on the duration or the intensity of the contact? Does that matter?
Yeah, absolutely. So the more you expose, the worse it is. I just put it that way. And everybody is affected a bit differently. We all have varying immune sensitivities. We're all of varying ages. We know that naturally, the older you are, your lungs kind of change a bit. Okay, the kind of elastic properties of the lung change as you get older, and adding insult on top of that actually increases your risk of manifesting disease once exposed to these hazardous compounds, which is another reason why this is so important, because that burden on the health force, our health force is changing. We have a lot of older people that are in the workplace and in industry, and they are now exposed to these diseases. And it's actually, it's interesting is that silicosis, which is one of those inorganic dusts, is making a resurgence. We've been noting that as of recent, within the last decade or so. So understanding the host is important. But the goal is to get exposure to zero. That's the so we can limit that as best as possible. That'll kind of help keep us on an even keel, if that makes sense.
Yeah. I mean, you mentioned that you'd want to get exposure to zero, but for some people, depending on the nature of your work, even like what you've trained in, sometimes it's like, well, you feel like this is the only work you can do. For some of these substances, is there such a thing as a safe level exposure? So like when you think about your nail tech, when you think about people who work in like cleaning services, construction and all of these sorts of areas where there's a lot of potential exposure, is there anything in those areas or any others that would be common that would be considered, hey, well, this is a safe level of exposure where you feel like, you can kind of go through your life, do your work, build your career, and not feel like you got risk for like serious health concerns?
Yeah, man, that's a tough question. The answer really is, I think the overarching answer is no, because we can identify a safe level of exposure, right? If you think about it, our lungs are very unique organs. We're exposed to antigens, bacteria, and pathogens every time we take a breath, which is why when you talk about like transplant, for example, transplanting the lung is literally maybe the hardest organ to transplant, because you're so exposed to immunogenic material that your risk of graft rejection is so high. So when we talk about a safe level, that's very hard to quantify. So the overarching guidance within the medical community is that we want zero exposure. Thing is now, if you are a nail tech and that's your job, you have to do your due diligence. And if you start to have symptoms, then you need to go and get checked out and see a primary care doctor and start the evaluation. But, in the interim, do your due diligence and protect yourself. So if you're going to be around this all day, wear a mask. Better off wear a respirator, which kind of protects against smaller particles, submicron particles, so that you can limit your exposure as best as possible.
Yeah. You mentioned being aware of symptoms and, getting checked out as soon as you kind of feel or see that something is different. What are some of the early symptoms that people should look out for, if they work in one of these, especially the more high risk industries? What should they be aware of to say, I might need to go get checked out?
Yeah, so the early symptoms are very non-specific. Like I said earlier, we're talking cough. You may have some chest tightness, some shortness of breath. You may have some wheezing. And these symptoms kind of go overlooked by both patients and providers. If we could leave anything from this talk is, you as the patient have to be your biggest advocate, and you have to say, once I start having these symptoms, I need to go to the doctor. These symptoms can then progress, obviously depending on the type of disease that you have, but the shortness of breath can get worse, the chest tightness gets worse, the cough is prolonged, and now you're having coughing fits, or you're throwing up after a bout of coughing. And the cough is usually non-productive, a dry, non-productive cough. But, if you manifest disease, you may develop something called hemoptysis, where you actually start to cough up blood. And that can happen in a variety of these cases. And you don't want it to get to that point, right? You don't want to be seeking healthcare, advice and services once you've reached kind of the extremes of your symptomatology. You want to do it early so that you can be screened early and identify an exposure and limit and cut that off.
Yeah. Well, for anyone who listens to the show regularly, we are strong believers in early diagnosis, early intervention. So being, trying to be aware. That's a part of the reason why we do the show, right? Is to give people information to help them be aware and then be able to kind of tackle and investigate things as early as possible. Because the earlier you can find something, the more positive your outcomes, are potentially once you get to know it early. So what are some like strong red flags that people, if they see it happening, that, you mentioned if you cough up blood, obviously that would be a big one and an easy one, but what are some other red flags that people should be aware of that would prompt them to consult a physician immediately, especially, if they've started to know, well, I've had, a cough off and on here and there, and it wasn't really like flu season or it wasn't anything like that. Like, how do they kind of start to put together that story so that they can be better advocates for themselves?
Yeah, definitely any progression of symptoms. You've realized that, you've had this cough on and off, but now you're coughing all throughout the day. You can finish a sentence and you're still coughing. If there's a change in your ability to care for yourself, we call it the activities of daily living, right? So you're so short of breath that you can't complete your shower without being winded. You can't walk up the steps as you used to before. You have some change in your social functioning and life because of symptoms. Weight loss is another one. That can be the result of advanced COPD, that could be the result of cancer, or interstitial lung disease, pulmonary fibrosis. So those are the big red flags. But, again, I have to reiterate that that's the later effects of things. You don't want to be presenting to the healthcare setting at that stage. Early detection of what's going on. When you first have those initial symptoms, just go see your primary care doctor and get checked out.
Yeah. For you, when you're evaluating a patient who you suspect may have occupational lung disease, what does that diagnostic process involve? Because I think sometimes people also, especially in a post-pandemic world, there's a lot of sometimes fear of going to see a doctor, things like that. And what are you going to do? How are you going to try and figure this out? But what does that diagnostic process look like if a patient is going through and you think that they have occupational lung disease?
Yeah. So I had a really good mentor in medical school that always said, there's no good medicine that comes from a bad history in a physical exam. So your process always starts with that. You want to take a detailed history of the presenting illness. When did the symptoms begin? Any pertinent associated symptoms, is progression and any exacerbating factors. Then you want to perform a detailed occupational and environmental history. So really trying to understand all possible pertinent exposures, right? Yeah, you may be working in the hotel industry, but how often are you dealing with the linens? Or, do you also wash the clothes, and what are those chemicals? Was there something that changed? Really get into the nitty-gritty of what their day-to-day looks like. And then once you've done that, you want to try and link the symptomatology with the work exposure. And that in itself is probably the most important part. Because if you can determine that when this person goes to work, this is the only time they're having shortness of breath and wheezing. It started when they got this job. When they go home, they're feeling better. That really does definitely increase the likelihood of this being occupational lung disease. After doing that, you perform a physical exam, and I usually begin with some form of chest imaging, whether it's an X-ray or CT, or based on symptoms of what I'm thinking about. But most of these patients will get some form of chest imaging, and then the further diagnostic workup depends on what I think the underlying cause is. So if I think they have work-related asthma, maybe it involves peak flow monitoring while they're at work, or shortly before they come home, or shortly after they come home from work. There's immunological tests and workup that you can do if you think there's some of that organic exposure that's going on. Lung function testing, if you think they have ILD, that's interstitial lung disease, to see how well they're able to comply, and understanding their lung functions in that regard. So that's basically the way I do it. And oftentimes you come up with an answer or a decent list of differentials.
You mentioned again already how important early detection is. And I think that's something that I think with a lot of these circumstances when it comes to health-related issues, we can all agree that early detection is very critical. But, when you start to think about for people who are working in these environments, right? What are some other steps that they can take to reduce that personal risk? Like you mentioned, masks and respirators, but is there anything else? Like, is there value in saying, when you think about, especially like the nail techs, right? So, I know some of the people that my wife has gone to over the years to get her nails done, they'll be in that chair all day, right? They're not getting up to really go out and take lunch. Like even like, is there any efficacy in saying, I'm going to take an hour of lunch to be out of the space and get distance? Does that matter at all? Like, what are some other things people can do?
Yeah, definitely anything that they can do to reduce their exposure, whether that's wearing the appropriate respirator. I think, in my opinion, that's probably one of the best things someone like the example you gave, a nail tech, can do, because like you said, they're sitting in that chair all day, removing themselves from taking time away from it. So the lunch idea is really good. You just want to limit your exposure. But the other thing that people can do is really, be advocates for themselves by researching, what they're exposed to, looking at the back of the bottle and talking to whoever is in charge of the salon. And, if it is that you're working in a bigger industry, going to HR, finding out what are the regulations. Oftentimes people kind of forget that in order for these businesses to function and run, they had to kind of comply, or at least say in their bylaws or whatever, that these are the things we're putting in place to protect our workers. And oftentimes those things aren't enforced, or, people just don't do it. And that doesn't mean that you're not mandated to do it, right? So you may be working at an auto body shop and nobody wears a respirator when they're spraying a car, or they're just wearing a regular, surgical mask, a cloth face mask. But go to, speak to HR, go to these people and read whatever the bylaws are for the business, and know what it is you're supposed to do. Now, if those things don't exist, you can also reach out. You can go online. You can reach out to your local agencies, the Department of Labor, and find out what exactly it is that you need to be doing, and do that. Often, you'll be in the warehouse and you look in the back wall somewhere and there's some sign, right? Something on the wall that's up that no one ever reads, but it's saying that you should wear an appropriate mask, appropriate PPE when in this area during this time. So simple things like that definitely do go a long way and protects you, not just protect your health, but also protects you from like a legal standpoint, right? Because you were compliant with whatever the business said you were supposed to be compliant with from a PPE or exposure standpoint. But anything to limit your exposure to the potential hazardous inhalant is what you should do in order to protect yourself.
Yeah. This might be a bit of a tough question, because I know even during, like, when people are going through COVID, one of the questions they always have is like, are these PPEs even effective? Because I know obviously that's something that you've mentioned in going through how people can protect themselves. What would your answer be to that from a clinical perspective? Like, how effective are PPEs like masks and respirators at protecting workers? Like, is there a percentage? Is there any study that says, there's this amount of reduced risk? What does that look like?
Yeah, I mean, PPEs are definitely effective. When we're talking about inhalational exposure, so we're going to be talking about masks. You have masks and you have respirators. And, these respirators, in comparing the two, it's just the amount, the size of the particle that it kind of limits you from inhaling, right? So one respirator that we're all familiar with is the N95, right?
Too familiar.
That was very, very big during the pandemic. There are others. There are the filtering face piece respirators, so FFP 1 through 3. 1 to 3 being the grade at which they're able to actually filter particles. So FFP3 can filter the smallest particles. There's also something called the elastomeric half face respirator. And all of these are going to be better at protecting you than a simple face mask, surgical mask, or cloth mask, okay? In terms of studies or evidence, we know that respirators can achieve filtration efficacies 94 to 98% for what we call submicron particles, very small particles. Surgical masks, 70 to 81%, and cloth masks as low as 28 to 47%.
Yeah. I worked 1 or 2 summers when I was coming up through high school with my uncle, who he paints boats for a living. And I always remember he had the big respirator on whenever he would go to spray a boat, right? And I didn't think about it then, but I guess just looking back and realizing like it was his way of protecting himself from what would be ongoing long-term exposure to chemicals. And like I said, you don't think about it in a moment, but you look back and realize, oh, this is why he was wearing a mask. Every time I saw him in the boatyard, he always had that on if he was spraying a boat, because you understand and you're aware of the potential damages of the exposure. You mentioned a little bit on the HR side of it, and I think that's always a good portion of the conversation to kind of tackle, right? So we've been having this conversation to this point mostly from the individual aspect, like you as someone who, whether you own your own business in a small business capacity or, if you're working for someone, but on the other side of that equation, the person who actually is owning and running the business, or if you are a small business owner and you have other nail techs that work with you or other people who work in your cleaning company, what advice would you give to that group of people for how they can, put in practices and policies within their own business to help protect their staff and potentially even their customers? Because even, with some of these things you're talking about, people who are coming into these spaces to get services done as well.
Right. Before I answer that question, I want to put a plug back in for that the respirator talk.
Sure.
The biggest part of it is proper use. So I know a lot of people have a lot of skepticism about masks and respirators, but you have to wear them properly. You have to wear them during the times when you're exposed, right? So when you combine using it effectively, using it during times of exposure, yes, it's extremely effective at reducing your risk of inhalant exposure and subsequent occupational lung disease.
Yeah.
Now to the question about what business owners can do. I think that the first and foremost, business owners need to understand their business and understand the exposures that they're putting their workers and by extension their customers at risk for. I think that far too often, we have great ideas. We say, okay, we're going to go ahead and and especially happens back home, right? You're going to hang your shingle, do what you want to do, make money, and there may not necessarily be a robust system in place to ensure that you've met certain standards, right? So I think as a responsible business owner, I think if you do your due diligence and you go out there and say, okay, I'm running a pool cleaning industry, and I want to clean all these pools here in Nassau, but I need to make sure that I understand that the people that are dealing with the chlorine gas or, these heavy fumes, they're not going to be, they're going to be protected appropriately. Know what that protection looks like. I think that business owners also need to reach out to the Department of Labor. I know that there's the Health and Safety Work Act of 2002, and it basically says that you as a business owner, you have the responsibility for the safety and welfare of your employees, and obviously by extension, your customers. So reach out to the Department of Labor, figure out what it is, what local guidance is in place for your specific business, and follow that. But that would be the biggest things I could think of.
Yeah. Is that our version of like OSHA in the States?
Yeah, from what I was able to look up online, that is our version of it. And there may be more that's just not available online, but go and speak to the people on the ground, your local representatives, and get a better idea of what it is that you need to do to protect your business.
Yeah. When we think about, ways to protect yourself, is there some sort of like lung screening that people can do if you're working in certain professions? Like, is that something that they should be doing? Like, should routine lung screenings be standard if you're working in like, in the pool cleaning industry or in healthcare or the nail salon, cleaning companies, things like that? Is there something that exists that would be like a routine lung screening, and should that be something that's standard?
Yeah, that's kind of a tricky question because what does the lung screening look like? As of right now, the current U.S. guidelines for lung screening is lung cancer screening, and we screen people who've been, smoking cigarettes, a certain significant amount of cigarettes between the ages of 50. The patients are 50 to 80 years of age, and they have to be smoking greater than equal to 20 pack years having quit within the last 15 years. So that is what we use in terms of lung screening, and they get screened with low dose CT scans. That has not been applied to other diseases and exposures. This is specifically to cigarette smoking. There have been some studies that try to see whether or not we should expand this screening, meaning the CT scans screening, for other exposures and other potential lung diseases. However, this just hasn't panned out when you try to balance the risk benefit of it. So as of right now, there's no formal screening. Now, I would say if I can be in control of this all on my own, it's probably very hard to identify a screening tool for something as big as occupational lung diseases. I think the better thing is everything that we've been speaking about. Have patients get informed about their potential exposures to protect themselves, wearing the appropriate PPE, and limit exposures. And as soon as you have some symptoms, you present early to your healthcare provider, and get evaluated to see whether or not you're actually manifesting disease. But yeah, as of right now, there's no screening, and I think it will be very hard to come up with a screening modality for this big group of diseases.
Because it's such a wide list, and because there are, I guess, potentially other factors that could be in play that people may look at first, as opposed to thinking, this has some correlation to your workplace.
Yeah, exactly. I mean, if you think about it, if you are someone who you're at work and you're exposed to some cleaning product and you start wheezing, right? That screening is going to look different from, that wouldn't even really be screening, but evaluating that patient is going to look different than evaluating someone who's been exposed to secondhand cigarette smoke and is now having a cough and losing weight, right? That latter patient can benefit from a CT scan that may show a nodule that may be cancer, versus the first patient that probably needs peak flow monitoring, to evaluate for work-related asthma. So I think, and again, these are patients who actually have manifested symptoms. So that's not screening, that's evaluation. But
Right.
it's very hard to think of, okay, well, what modality would I use as a long screening metric for all of these groups of diseases that have these, what we call protein manifestations, right? Just meaning that varied manifestations, varied diseases. Yeah, I think that's just a bit too difficult to think of. Maybe there's like a questionnaire or something that someone can come up with as maybe an initial tool to see which patients may be at greatest risk, just based on like pre-existing lung conditions or familial risk factors. But yeah, that's all I can think of right now.
I mean, I imagine it might be helpful to, because you mentioned like there's an occupational aspect of the history taking process, and maybe there's an opportunity to lean more into that space, or to perhaps develop a questionnaire that maybe makes it easy or quicker to get through. Because I know one of the things when you have a patient in front of you is a lot of it's you have 15 minutes or you have 30 minutes to get through the process. And so if there's a way to get that information in more quickly, perhaps there's an opportunity there. But again, it's still closer to once you're on the evaluation side, because you're in front of the physician because something's wrong, right? So it's still a little different. Okay, so as we look to kind of wrap up our conversation, one of the things that I think when you talk about a topic like this, that becomes, I guess, a critical component of the conversation is, at a national or like even a local policy level, do you think that there is, work to be done, or do you think that there's an opportunity perhaps to strengthen or improve occupational health and safety, given like we've seen things like OSHA in the States kind of become a very important part of that process for evaluating like workplaces and employee health and things like that. Is there work to be done perhaps on the legislative or the policy end in our country to assist in this area?
Right. Yeah, I mean, I would say definitely enforce whatever's already in place, enforce policies that are already there. I think that empowering people with information. So like what you're doing right now, if the government, can go ahead and push initiatives, whether through TV ads, posters, church visits, health fairs, to really shed light on occupational related diseases in general, not just lung diseases, so that the public can be aware and they can arm themselves, because that truly is once the patient themselves can arm themselves with knowledge and be their biggest advocate. I keep saying that. I think that's when we get meaningful change from a healthcare perspective. And I would say the next thing is we probably do need some form of kind of organization, major group that's partnered with physicians to kind of come up with very clearly defined, easily accessible guidelines and policies for, like we talked about earlier, business owners, as well as employees. I did, my Google searching, being here. And I wasn't able to find that much, so I guess my point is it shouldn't be that difficult to be able to find the information. So we definitely can improve in that space. And if we do have the partnership with physicians, I think that's taking it the next step further, ensuring that our patients are safe.
Right. As someone who is actively in fellowship and, is looking and learning about things like this, and even, working with patients potentially who have these sorts of issues, what opportunities exist for physicians or the physician community to partner with, whether it be industry and or government, to reduce the long-term burden of lung disease? Because if you think about it from an employer standpoint, right, if you have a tendency of people, developing illness and not being fit for work and things like that, it does become even just a burden to your business. That's beyond just the initial human element of these are people who, have lives and families that they're working in this environment to kind of assist with. But, just from even just the more as the employer, from that standpoint, like, are there opportunities, whether it be through education, whether it be through like seminars, workshops, things like that, or even policy development, what opportunities exist in that space where physicians or the physician community can help?
Yeah, I mean, there are physicians who actually specialize in occupational health. They work alongside government agencies and private institutions to ensure compliance standards are met. They make sure that they kind of help them identify potential hazards. So definitely, I guess, encouraging more physicians to go into that space. Having physicians know that that's an option, because oftentimes, a lot of doctors don't know what the varying fields are that they can specialize, subspecialize in. And I think beyond, like I was saying before, the health fair, going to churches and getting the word out there. Beyond all of that, that's all really good. I think all doctors, in particular generalists, so you talk about your family medicine doctors, primary care doctors, need to really educate themselves on this and kind of add this extra tool to their toolkit to say, when my patient comes in with a chronic cough, I am going to think beyond the GERD and the respiratory illnesses, like the infectious illnesses. I'm going to, remember the occupational side of things. And whether that's by having a bit of like we talked about that questionnaire, kind of having that tool in the clinic while you're waiting to be seen, and you have the patient fill that stuff out. And that will kind of help guide just how deep down the rabbit hole of occupational lung diseases do you go down, because you don't want to be that clinician that has the patient coming with a chronic cough and you send them home on some cough suppressants and you miss the lung cancer, right? And these things happen. I will tell you, I mean, just on a personal level, I had a relative that is in the construction industry, and this literally just happened, I want to say maybe 2 or 3 months ago. We were all at a family gathering and we were all just talking, and kept saying how he has this chronic cough. And I know he's heavily in construction. And I was saying, what all stuff you've been done? Oh, I've been seeing my doctor, getting my annual. They think there's nothing much of it. I've been getting some cough suppressants, but it's still here. And I said, well, given your exposure history, at a minimum, you should probably get a CT scan, some form of chest imaging, and see someone. And he did that, went, saw a doctor and had imaging done. And he had a vastly abnormal CT scan of his chest. To the point where, now the diagnosis is kind of ominous, right, in terms of the fair diagnosis. And it's now we're at that later stage where we have to, make a diagnosis quickly to initiate potential treatment. But, this is something that had been going on for months to even maybe a year, and he had presented to his healthcare provider. So I think as physicians, it is our responsibility, whenever a patient comes to your office and they see you, it's our responsibility to be able to provide them with the expertise, because they've done their part. Right now, it's up to us to do our part, and make sure that we're not missing anything. And this is something that's easily missed. It's easily missed. It's no, spot diagnosis when they walk into the room. You have to have a high index of suspicion.
It's like you can tell a broken ankle when it walks in, right?
Exactly.
It's not necessarily the same with this.
Yeah.
All right. So finally, Dr. Adderley, what message would you like to leave with our listeners, especially those who think they may be experiencing symptoms or are working in high-risk jobs?
Yeah, I mean, if that's you, first of all, if you're having symptoms, you should see your healthcare provider. And if you were listening to this talk with symptoms, you're already giving your doctor a gift, because you already sat down and thought about all the symptoms, and you're going to give them a detailed history of your occupation and your exposures. I would say keeping a symptom diary is a big plus. It helps us out a lot. I want you to sit down and think about when you started having symptoms and how it related to your job exposure. What exactly were you exposed to at work that you think may be hazardous? When do you feel better? Do you feel better at home? Do you feel better when you leave the country, right? What exposure is it? Because we're talking about occupational exposures, but these are also environmental exposures, right? And by doing that, you save a lot of time. because now your doctor doesn't have to sit down and ask you all those questions. You have it all just neatly there. So that's a way of being your best advocate. And then do your due diligence, read your employee handbook, speak to HR representatives, make sure you're doing what you're supposed to be doing to protect yourselves. And, I would say spread the word. You may be in a field where you have exposures and you've seen people get sick and whatnot, and you have a family friend, a colleague that also in a job, potential exposures, spread the word, empower one another, and don't be afraid of going to the healthcare provider early, and speaking up, just letting them know, hey, I have a cough, I work in, this industry, I'm in agriculture, I'm in waste management, I have a concern that this is related to that. Mm-hmm. Your doctor may not believe in the beginning because they have to do their due diligence too and rule out all the other things, but at least you put on the table and it will be addressed.
Yeah. All right. Well, I want to thank you so much, Dr. Adderley, for taking time out of your busy schedule to come and have this conversation with us. I'm sure for our listeners, especially those that work in some of these high-risk areas, this is going to be a wealth of information that they can take and consider as they navigate managing their own health. But thank you for your time today.
Absolutely. Thank you so much for having me. Anytime.
All right. So that brings us to the end of today's episode of Vital Voices. A heartfelt thank you to Dr. Patton Adderley for shedding light on the risks, realities, and responsibilities surrounding occupational lung disease and reminding us that prevention begins with awareness. If you or someone you know works in a high-risk industry and is experiencing symptoms like chronic cough or shortness of breath, don't wait. Talk to your physician and take the necessary steps to protect your health. As always, we appreciate you tuning in each week for the nation's most vital conversations where insight meets impact. Until next time, I'm Alexis Burrows. Stay informed, stay inspired, and stay well.
We'd like to thank today's sponsors, Oak Tree Medical Center and Wellspring Lifestyle Group.
Are you enjoying Vital Voices? Do you find our conversations educational, engaging, and inspiring? Then like, subscribe, and tap that notification bell to keep updated on new episodes and more.
Vital Voices.